thank you all for attending the first of a three-part webinar series related to community health needs assessments. And the purpose of these webinars really is to revisit what is actually a fairly old, in this day and age, an older requirement for organizations that are exempt under 501c3 as a hospital to do a community health needs assessment. So today's session is really going to focus on kind of some best practices around community health needs assessments and really the IRS requirements, because surprisingly, we're still seeing that the IRS is interested in this, and we're still seeing a lot of questions just with respect to what are those requirements and how do we ensure that we're meeting them. The second webinar in the series will be focusing on how can you use your community health needs assessment to help you from a strategic planning standpoint. And then the third session will be looking at some case studies of organizations who have done some creative and unique things with respect to their community health needs assessments. My name is Kim Henderson, partner in charge of the exempt organization tax here at Eide Bailey, specialized in working with all types of nonprofit organizations, but hospitals take up a majority of my time. So today we're going to start out by just talking high level about some benefits of doing a community health needs assessment. Obviously, this is a requirement, but we like to think that there are actually some benefits to the organization for doing this beyond just meeting its IRS requirements. Then we'll turn over to just going through those IRS requirements. Really haven't changed much in the last 5 years since the regulations have come out, but we'll just revisit those at a very high level. We'll talk about some best practices and then some updates with respect to IRS activities in this area. So I put in this description of health because I think as we think about hospitals, a lot of times we can be focused on what happens inside the hospital with respect to helping individuals with that very specific health needs. But really, when we're thinking about a community health assessment, what we're thinking about is much broader than just what happens within the doors of a hospital. And we're thinking about it more as what are all of those different components within a community that can impact the health of the population. So it's the physical, mental, social well-being, not just looking at the physical ailments that individuals may have. And that's really a background for thinking about community health needs assessment. While it's important to know some of those specific health issues or things that the hospital might be seeing on a regular basis, it really does, we do want to go broader than that and think about what are some of those things within the community that could be contributing to the health of the community. Examples here of availability of fresh food, childcare, access to transportation. All of those things can really play into how the health of a community is defined. So benefits of conducting a community health needs assessment. Done correctly, you really can obtain valuable information on the health of your community. So while we can know what some of those more pressing health needs are that the hospital might be seeing directly, we also get to understand, well, who are some of the populations within our community that may have needs that maybe currently are going undiagnosed or untreated, or that have needs that maybe require additional help from organizations within the community, not just the hospital, but really can encompass other types of organizations. Are there some current gaps in care? You know, as I work with organizations on assessments, a lot of times this is what we're seeing is that individuals within the community are wishing that the hospital could provide some additional services, or there's some things that just really aren't being addressed. And this is an opportunity to identify what those gaps are and think about whether there's things either the hospital or others in the community could be doing to alleviate those gaps. Identifying whether there's any barriers to receiving services. So I mentioned earlier transportation. In a lot of rural communities, we do see that transportation can be a barrier for certain groups of individuals to receive care. So is there something that could be done within the community to help eliminate that barrier? And then it also helps to provide information on other service providers, maybe not necessarily health services, but other services that are being provided by other organizations within the community. One of the assessments that I worked with, we brought together a group of different community members and representatives from a number of different community organizations, and it was a really powerful exercise when people around the room would bring up what they perceive to be a need within the community, whether it be for a certain type of service or a certain type of help, and someone across the room from another agency would say, well, really, because we do that. So in that situation, we brought together different people within this community, and at the end, a lot of the gaps that they perceived were there were actually really more just a lack of knowledge about the different services that were being already provided in the community, but people just didn't know that they were being provided. Meeting state reporting requirements. Currently, there's at least 12 states that require that there be some level of community health needs assessment being done by hospital organizations, and that's in addition to the requirements by the IRS. Strengthening community relations. I think that's something that every hospital wants to ensure, is that the community feels that that hospital is being a real asset to the community. So doing this community health needs assessment helps you to collaborate with other providers, finding out what other services are out there and developing relationships with others in the community. It definitely builds a positive perception with your consumers. Instead of assuming what kinds of needs are out there and what they want from the hospital, it's better to ask and get their voice as we're doing this. I think as consumers, we always want to be able to have our voice be heard. So asking people within your community what it is how they define their health or what they see as a need helps to give them that voice. Doing a community health needs assessment can address the increased focus on population health. As we all know, there is an increased focus on how are you improving the health of your community and what kinds of outcomes are you achieving from the work that you're doing. So being able to monitor and on a regular basis assess how the needs are changing will help you to focus on population health. And then professional standards, many of those do include some kind of a reference to addressing the needs of the community. So not just doing medical services for the sake of doing medical services, but doing them because there is a need for them in your community. And then lastly, utilizing this in your strategic planning. And I think you'll definitely hear more about this in the next session with Adam and probably in the session after. But really taking what you're learning in this assessment and building that into the organization's plans. So using this as a way to look at the services you're currently providing and are they being effective? Are there things that you're hearing within this assessment that would indicate that maybe some of the services you're providing aren't currently meeting the needs, or maybe there's some new services that are seen as more critical to people in your community. And it helps you assess as you're thinking about new services. Well, is there really a need? Do people perceive that they want that service? How is it going to contribute to what you're finding as needs as you're talking to the population? So Adam will touch on this much more in the next session. So true or false, at least 12 states currently require some level of community needs assessments. Wonderful. So we have 100% with true and 4% with false. So we actually have 104% participation. So on a webinar, I would consider that a win if we have more than the people taking part participating. All right, well, with that, we're going to move into the IRS requirements. So it's hard to believe, but these requirements actually came into place back in 2010. I personally feel like we've been talking about this for more than almost 10 years, but only been 10 years, which means these are things that all of you are familiar with. I don't think that this concept is coming as a surprise to anyone. If it is, maybe you're new to healthcare, that would be my hope. But Section 501R came into place back in 2010, which effectively put into place rules that hospitals that are exempt under 501c3 must do in order to maintain that tax-exempt status. So there's 4 different components: conducting the community health needs assessment, having a financial assistance policy and an emergency care policy, limiting the amounts that are charged to individuals under financial assistance, and having billings and collections policies and procedures. We're not going to talk about those other 3 today. We could definitely spend much more than an hour talking about all of those things, but I will tell you that all of these different components are really important, and it is important that hospitals continually assess where they're at with respect to having these in place. And as I will talk about at the end, there continues to be IRS enforcement throughout all 4 of these requirements. So under the CHMA requirements, the biggest one here is that the hospital has to conduct this community health needs assessment once every 3 years. So for most organizations, if you haven't already, you will probably be working on your 3rd community health needs assessment, because most of these were done for tax years beginning after 2012. So for most organizations, what we're seeing is that they had an assessment done in 13, 16, and 19. So if you're an organization that thinks, I don't know that we've actually done 3, you may want to make sure that you know where you're sitting with respect to this time frame. In doing this community health needs assessment, you're required to conduct the assessment, document the results in a report, and develop an implementation strategy. And both the report and implementation strategy have to be made publicly available. We'll talk later about what that means to be made publicly available. And probably the biggest component of this that I always want organizations to remember is that there is a $50,000 per year annual fine if the assessment is not completed. So the big stick that the IRS has with respect to 501R is that they could revoke an organization's tax-exempt status if you're not complying with 501R. But this $50,000 penalty is specific to the community health needs assessment, and it can get applied in addition to loss of tax-exempt status, or it can be applied even if the IRS doesn't feel that revoking tax-exempt status is appropriate. They still can apply and do apply this $50,000 fine. So that is something to really be aware of, and I'll explain later situations where we are seeing this penalty being assessed. So the community health needs assessment is considered to be completed or conducted within the tax year where the written report and the implementation strategy are approved by an authorized body and made widely available. So when you're looking at when this has to be done, the assessment itself and the report have to be completed within that tax year that would be the 3rd year in your cycle. So that is done by the last day of that taxable year. The implementation strategy, which is the strategy as to how you're going to meet the needs, doesn't have to be approved and made available until the 15th day of the 5th month after year end. So and that's the same day as your tax return is due. So if you're a calendar year taxpayer and your 2019 is your next year that you have to have your assessment completed, you need to have your report approved and posted on your website by December 31st, and you have to have your implementation strategy approved and either posted on your website or attached to your tax return by May 15th. And this is one of the areas that we see most often is the failure to meet this time frame. And sometimes, we'll hear clients say, well, our board didn't meet before December 31st. They met January 15th, so we had it approved January 15th. Well, technically, having it approved January 15th does not meet that requirement, and therefore you would be subject to that $50,000 penalty for 2019 because your report was not complete. I'll talk in a few minutes about the rules with respect to where the IRS has come out and given some examples of where they will and will not enforce the penalty and revoke tax exempt status in those types of situations. So the requirement to do a community health needs assessment applies to all licensed hospitals, and it also applies to governmental hospitals that have dual status. So some governmental hospitals applied for tax exempt status under 501c3 at some point in the past. Usually that was done because they wanted to be able to provide certain benefits under a 403B plan, so they got tax exempt status to provide those benefits. This is probably where the IRS is doing finding most of the issues at this point, are these governmental hospitals that were unaware that they have 501c3 status and therefore may not have been following the rules. I'm guessing that we probably don't have many people on the call today that would be a governmental hospital that doesn't know that these rules apply, but it's surprising that we're still seeing some of this happening. And governmental hospitals can, or any organization can confirm their 501c3 status. Out on the IRS's website, there is a master file of exempt organizations. A hospital facility is defined as a state licensed, registered, or similarly recognized hospital. Sometimes we'll have questions about whether an organization is truly subject to these rules, and the definition does go back to that state license. It does also include in the hospital that's operated through a disregarded entity, so maybe a single member LLC. It also includes hospitals that are operated through joint ventures. So sometimes two organizations, maybe it's a hospital and a group of physicians, might have a licensed hospital that they're operating. And even though that's owned by physicians and it's owned in a partnership, that hospital is still going to be subject to the 501R rules. The only exception to that is if the hospital treats the revenue that's flowing through to it from that partnership as unrelated business income. So in other words, it's already treating it as taxable income. These rules do not apply to any hospital facilities that are operated without or outside of the U.S. So polling question number 2, what does CHNA stand for? All right, so now let's talk about some of the specific requirements when you're thinking about conducting the community health needs assessment and doing the reports themselves. So in conducting a community health needs assessment, the rules require that you have to define the community that you serve. And I think it's important to know that there's no guidelines really with respect to how you define that community. So I think most organizations will probably look at statistics with respect to maybe their inpatients or outpatients, where most of the patients that they serve are coming from. It's usually probably a county, it might be a couple counties, but however the hospital typically looks at their service area, that's how we typically see that the community is going to be defined. The only thing the IRS says is that you cannot specifically define your community to exclude medically underserved minority or low-income populations. Now, I don't think that most organizations would even think about doing that, but the example they would give would be, if you have a portion of your county that represents, a medically underserved population, you can't say, well, we're going to define our population as this county except for this group of people. Again, I don't think that most organizations would even consider doing that, but that is in the rules. And then you can define it to include other areas or populations if you're conducting it in collaboration with others. So there is a provision for organizations to conduct these assessments together, in which case 2 organizations might define their communities, and each of them may define it broadly, and then within that broad definition, each hospital defines their own specific community a little bit more narrow. So it can go a little broader than how you would normally define it. You are required to solicit input from the community, and there are 3 specific sources of input that you are required to include in your assessment. So you have to include at least one state or local, tribal, or regional government public health department or state office of rural health. So when you're doing your report, when you're doing the assessment, it's really important that you reach out to one of these organizations and ensure that they're part of the assessment in some way. Maybe they're part of your focus groups, maybe you have a one-on-one conversation, maybe you actually conduct it jointly. Maybe the State Office of Rural Health is actually the organization that you contract with to do it for you, but somehow they have to be involved in the process. You also have to include members of medically underserved, low-income, or minority populations, or individuals who serve those populations. So this is probably where it can be the most challenging, is how do you ensure that you reach out and include those people in your conversations or in your surveys. What I typically see is that those individuals may be specifically identified to get surveys. Maybe you work with an organization that works directly with those populations and ask that they conduct the survey for you. It may be reaching out to leaders. So for instance, if you had an American Indian tribe that is within your community, maybe it's reaching out to someone who would represent that organization or those members of that community as part of your assessment, and having conversations to truly understand the needs of that segment of your community. And then you also need to include any written comments that were received on your most recently completed community health needs assessment. Now, I will say that in all the years I've done this, I haven't seen anyone actually get any written comments on their most recently conducted assessment. But if you did receive any comments, you do need to make sure that you're considering those in the assessment. And you need to be able to show that you at least tried to obtain this information. So when I'm reviewing reports for organizations or when we're conducting them, I want to make sure that the report itself specifically talks about how you got the input from these 3 different pieces of information. So it could be very specific in saying the hospital did not receive any written comments on its most recently conducted assessment. If it had received comments, they would have been considered as part of our assessment. So it seems, a little blatant to put that in there, but I think it's better to show it than not show it. And then you're supposed to get general input from members of your community, and that can look a lot of different ways. That could be surveys, that could be task forces, that could be focus groups, lots of different ways that you can get that general input. You're required to assess the needs of your community. So those needs will come up based on what you're hearing from the people you're talking to. Most of the time you're going to look at some secondary data, so health data that you can get from the state or from your Department of Health or your Office of Rural Health, other types of data sources that give you some information on the statistics within your community and the health needs that come up through those kind of data points. Once you've gathered all the information, you identify your significant health needs, and then you need to prioritize those health needs. So just because you have 15 things that come up as potential needs within your community, that doesn't mean that all of those have to be the ones that rise to the top and that you identify as the things that are going to be action points for the organization or for the community. So instead you use a process to prioritize. I think it's helpful and beneficial if you include members of the community in that process to do the prioritization. A lot of times I do see that prioritization might happen within the hospital administrative staff, and I think that's okay, as long as there's been some feedback from the community to help you understand what the community's perception is with respect to what the priorities might be. Some possible criteria that the IRS gave in prioritizing the health needs might be, the scope, the burden, severity of the problem, the feasibility and effectiveness of doing something, any health disparities that might be associated with the needs, and then again, the importance the community is placing on that need. And then the last thing with respect to assessing the needs is identifying potential measures and resources to meet that need. And this is where it's really beneficial when you bring a number of different groups and organizations around the table as part of this assessment, because it's not just the hospital's responsibility. It's the hospital's responsibility to do the assessment and to create a report and develop their own implementation strategy. But a lot of times the most effective situations are where you're engaging others in the community. Maybe you're engaging the public health department. Maybe you're engaging other nonprofit or service organizations that are all working together to address the needs. Then I've mentioned it a number of times, there is a report that has to be issued, and the report has to have certain information in it. So sometimes I'll see that organizations will put a report, what they're saying is a report out on their website that really is just a sample of all of the survey questions that they submitted to people in the community and the results of those survey questions. And while that's valid information, it really isn't addressing all of the things that are required to be in the report. So the report does require you to describe your community and how you determined it, what the process and methods were for gathering data, analyzing the data, which organizations the hospital worked with, and if you contracted with someone to assist you with this community health needs assessment, that should be identified also. A lot of times what I'll see is when organizations identify, or hospitals identify the organizations that they collaborated with, that might be a good place to identify which of those organizations maybe work with or represent those communities of people who are the medically underserved or the lower income. So that's, if you're not bringing those people specifically to the table or getting their input, this is a way to say, well, we have the United Way part of our assessment, and the United Way represents individuals who are medically underserved and lower income. So it kind of shows how you brought that feedback that's required to be brought to the table. Again, how did you take into account input from persons that represent the broad interest of the community? So what input did you receive? Did you do a task force? Did you have different focus groups? Did you conduct a survey? And what was the time frame for that? So sometimes I'll look at reports and it's not real clear when that process took place. So was it over a 2-month period, or did you have 5 focus groups over a 6-month period and then you did a survey? So you gathered that information over a longer period of time. No requirement to do it in 2 months versus 6 months, but there is that requirement to provide the time frame. Again, which organizations provided input, and a description of those populations that were served or that you brought input from. So again, being very specific to make sure you say, we did get feedback from the medically underserved, the low income and minority populations, and how that happened. One key thing is you do not need to include names of individuals who participated. I do see a lot of organizations that do include names, and that's completely fine if you're comfortable doing that, but just know that you're not required to include people's specific names. The report also has to have a prioritized description of the significant needs identified. So again, while you're having your conversations, there might be 15 different needs that people bring up. You don't necessarily have to have all of those 15 listed, but you do need to come up with those top needs that you've prioritized, whether there are 3, 5, sometimes I'll see even up to 10. I think you have to be careful in prioritizing and identifying too many needs, because you want to make sure that you can actually do things with respect to each of those needs that are going to have an impact on the community. And then what were your criteria for prioritizing the needs? And then a description of those potential resources that might be available to help address the needs in the community. So who are the other organizations beyond the hospital that are going to be tapped into in order to address the needs? So I mentioned earlier that organizations can do the assessment in collaboration with other organizations. However, it is important that it's very clear in your report that that report is being issued by the organization, and specifically that the organization's authorized body has approved the report. So if you end up doing a separate report, so maybe you do this in collaboration with 3 other hospitals, but each of you decide you're going to do your own separate report, there's going to be parts of that that can be identical in each entity's report, because the process, who was involved, would all be the same. What you would typically see as being different then would be a description of the hospital and maybe what that hospital has identified as the resources within its community to help address the needs, and what the hospital itself is going to address. A lot of times in those situations, we might see that there's 4 or 5 needs, and maybe each hospital is going to address 1 or 2 of them, but not all 5. You also could do a joint report, as long as all of the collaborating hospitals define the community as the same, and you conduct the process the same. But if you issue a joint report, it has to be very clear that each of the hospitals that are participating are detailed in that report, and that each of the separate boards is approving that report as the organization's report. The must be made widely available. This is where we are seeing the most activity with respect to the CHNAs right now, and that's because this is how the IRS is doing their testing, is they're going out to websites and they're trying to find your community health needs assessment. So you are required to have both your current and the most recent report out on your website. So at all times, you should have 2 community health needs assessment reports on your website. They need to be conspicuously posted on the website. Some agents that I've worked with have said, you know, it shouldn't be more than 2 clicks to find it on your website. So it should be someplace, maybe it's under community, maybe it's under the about the hospital, but it should be fairly easy for someone to find this on your website. You can meet this requirement by having your report posted on the website of another organization. However, it's not enough. You can't just say, well, it was out on my parent company's website, or it was out on the Office of Rural Health's website. If you're going to rely on someone else having it on their website, there has to have a link on your website that takes a viewer to that other website. So this is one area that we have seen some issues with, is this relying on other websites and not having the link that directs individuals to that website. And if there's a special software that's needed in order to pull up your assessment, there has to be instructions for how someone could download that software or get a copy of the assessment. In addition, you are required to have a paper copy available at your hospital facility without charge. And again, you need to have 2 years worth of the reports available at your hospital. I think most organizations probably have that at their admissions desk or at their front desk. That's probably something I would check on if you aren't aware if that copy is readily available in your hospital. So that would be a takeaway today. The other would be go out to your website and make sure that you can find 2 different reports available on your website. And if they're not there, it's usually that once you got the new one done, someone took the old one off. I would make sure that you get that old one put back up there. So the implementation strategy. So this is step 2 of the process. So step 1 is the actual assessment. Step 2 is developing a strategy. So the strategy is, now that we know what the needs are and we've prioritized them, what are we as the hospital going to do with respect to that need? Or maybe we're not going to do anything at all. So with respect to the needs the hospital intends to meet, your implementation strategy has to have these 5 bullets included in it. So what actions are you intending to take? What do you think the impact is going to be of the actions? What's your plans to address the impact? What resources are you going to commit? And then is there any planned collaboration with other organizations? And the resources that you're going to commit, that can be broad. It could be, we're going to commit staff time, we're going to commit financial resources. You don't have to get to the point of saying we're going to spend $500 doing this and we're going to spend $3,000 doing this. It can be a more broad-based approach to it. Now, it's important to know that not every need, even those that are prioritized, not every need may be something the hospital can or will be able to address, and that's okay. The rules don't say that just because there's a need in the community, it's the hospital's responsibility to resolve it. It just says that you need to identify it, you need to put action steps to it, or if you're not going to put action steps to it, you need to identify why. So some potential reasons that the IRS gave in the regulations as to why a hospital may choose not to address a need. You know, maybe there's resource constraints, lack of expertise, there's just not real effective interventions, or, and this is probably the most common one, it's a need that really isn't within the hospital's realm to address, or it's already being addressed by some other organization within your community. So I think that's a good takeaway, is just because the need is identified doesn't make it the hospital's responsibility. Approval by an authorized body. This is another thing that we are seeing the IRS looking at, and that is that both the report and implementation strategy have to be adopted by an authorized body, which could be your governing body, so your board of directors. It can be a committee of the governing body, as long as they've been authorized to approve this, and that's permitted under your state law, or if there could be other parties that were authorized by your governing body. But we are getting questions on IRS reviews wanting specific proof that reports were authorized by the board of directors or an authorized body. So what they're looking for is board minutes that show that the report was brought to the board and it was approved. I usually recommend somewhere in your report even putting a statement that says, you know, this document was reviewed and approved by the board of directors on this certain date. It just helps to verify with the IRS, if they look at it, that it truly was approved, because they feel that this is something that the board really should be involved with and should be knowledgeable about what's being identified. So polling question number 3, true or false? If you're unsuccessful, you must be able to get information from the community, you must be able to show you at least tried. All right, so in addition to just getting the assessment done, there are some other reporting requirements to be aware of. If there is any excise tax that's imposed, that has to be reported on the Form 990. The implementation strategy either needs to be on the 990 or the website URL has to be listed in the Form 990. And there's a question in the annual 990 that asks, what actions did the organization take to address the needs that were identified in its community health needs assessment? Or why have actions not been taken? And a lot of times organizations will just leave that the same as what they had in the prior year, but really this is the IRS checking to see that you're actually doing something with this over the course of the 3 years until you do the assessment again. So we do expect that that information is changing and that you can show that this is a living, breathing document. It's not just something you threw on the shelf, but that you are doing something with respect to those needs that were identified. So I mentioned earlier that the IRS did come out with some some safeguards against minor errors and in situations where maybe you just had something minor that happened with respect to your community health needs assessment or the other factors that are required, and will they actually revoke tax exempt status in these situations? So they did indicate that minor and inadvertent infractions, you need to correct it as soon as possible, and that they're considered minor if you have policies and procedures in place that are reasonably designed to facilitate compliance. So in this case, if they are minor, and the example that the IRS gave specific to a community health needs assessment is that the organization finds it wasn't available for a couple of days because some inadvertent technology malfunction. So it wasn't on your website for a couple of days because your website went down. Well, that would be minor, and that wouldn't be something that would result in revocation. In that case, the penalty actually would also not apply, because they would say that really didn't rise to the level of being a failure. So in that case, if you just have some of these minor things, we can get comfortable that you're not going to get assessed the penalty and they're not going to revoke tax exempt status. If you have a situation that's more than minor, but it's not egregious, so it's not rising to the level of being really significant, it will be excused if it's reasonably corrective and you disclose it on your Form 990. In that, however, correcting it and disclosing it only gets you out of the potential for revocation of exempt status. The penalty, the $50,000 penalty, still does apply in this situation because the exceptions aren't applicable to the penalty. The example that the IRS gives in this situation is you failed to adopt a report that contains all the elements, you discovered it, you corrected it, you got it approved, and you made it publicly available. So this is probably where we would see most of the situations falling into. So you correct it, you disclose it on your return. If you file a return, if you're a government entity that doesn't file a return, you correct it and you move on. And then situations where you're egregious, you're choosing not to comply, those are the ones where we would see potential revocation. They're going to consider all factors. We don't anticipate that this is going to happen very often. We've seen it. We've had one organization that's had their tax exempt status revoked. It was actually a government hospital that had dual status. They said, we're not going to comply with any of these rules. And by the way, we don't care if we lose tax exempt or 501c3 status because we don't use it. So the IRS revoked the C3 status, and the hospital went on its way without having to comply with any of these rules. So IRS enforcement, I've already addressed this a little bit throughout the presentation, but we are seeing the IRS continue to look at this. They are required. So Congress, when these rules came into place, Congress said, we want to know that you're actually making sure that hospitals are complying. So the requirement is that every hospital is reviewed once every 3 years. Most of the time, you don't even know that you're being reviewed because it takes place as a compliance check. Agents are looking at your website. They're assessing whether they can see all of the documents they should be able to see. If they get comfortable with it, you don't even get a call. You don't know that they even looked at you. When we do become aware that a hospital is being looked at, the reasons that they're being looked at depend on where we are in the cycle. So the first round of reviews, what we were seeing was that they were looking for community health needs assessments and implementation strategies and whether they were on the website. The second round was looking at the policies on the website. So did you have your financial assistance, your application, and your plain language summary? If they didn't find any of these documents or if you were missing things, then they would contact you and want to make sure you got it on your website. The most recent compliance checks and examinations we're seeing they are now going into the documents and looking at the requirements and making sure that the requirements are actually in the documents. So what we're seeing in the respect to community health needs assessments, one, are they on the website, but then is there indication that it was approved by a board, by the authorized body? I haven't seen them digging too much into, did you include the right people? Do you have the right information in the report? But I would anticipate we will see that as this process continues. So does it really matter? I already mentioned the revocation of exempt status. this is Kim's commentary, but I don't think we're going to see a lot of revocations other than the situation where a hospital blatantly chooses not to do a community health needs assessment, or, you know, chooses not to provide financial assistance, or the way that they provide it, or the way that they conduct their billings and collections is not meeting the requirements. I think what we're going to see more and more is the $50,000 penalties being applied on community health needs assessment, because that's money in the bank to the IRS. So I do think that they are going to continue to look at, well, I don't know if you had it on your website. You know, we went on your website, we couldn't find it, or we could only find one report. Therefore, we're finding that you weren't in compliance with the rules, and we're going to assess the $50,000 penalty. That's what we're seeing right now on some of our most recent audits, is that they are trying to assess the penalties in situations where either maybe an organization missed the requirement because they had their timing off, they didn't know they were subject to it, or it didn't get on the website, it wasn't approved by their board, and the IRS is assessing the penalties. And unfortunately, there is no reasonable cause exception to these penalties. Like other tax penalties, we can usually argue reasonable cause. We're not seeing that is something that we can do at this point. And then I will bring to your attention the Senate Finance Committee. There is an investigation going on right now. They are looking at hospitals. They want information on compliance with 501R. They want the results of the IRS's compliance check. So that's really the Senate Finance Committee going to the IRS and saying, we want to understand what you're finding on these exams. And most recently, just this week, Senator Grassley has issued a letter to a large hospital asking for a lot of information about their policies and procedures with respect to financial assistance and billings and collections, not specifically with respect to community health needs assessments, but we continue to see that hospitals are going to be scrutinized in this area. And our last polling question.
All right, last polling question here. How often does Congress require IRS to review the hospitals?
Okay, so it is every 3 years that they're required to do that review of each hospital. So they're continually conducting those reviews, but each hospital would be looked at every 3 years. And then we'll wrap up here with just some best practices. As you think about doing this process, a lot of you may have just completed it. Some of you may have it in process because you're on a fiscal year, but really thinking about collaborating with others. A lot of communities, your public health department may have their own requirement to do a community health needs assessment. Why not do it jointly? Why not work together to make sure that you're not duplicating resources? Collaborating really brings this common understanding of issues and joint approaches to solutions. Building broad and diverse community engagement. The more people you can bring together to work on this and talk about it, the less burden it probably is on the hospital. So, you know, bringing in your health agencies, other hospitals, education and social service organizations, really making sure you're bringing a good group of people together to discuss the issues. Making sure you're getting that input from your medically underserved, low-income, and minority populations, and being creative about what it might look like to get that information if you're struggling. I've seen situations where hospitals have done surveys and they want to do it electronically, but they realize that maybe not everyone has access to electronic means to do a survey, so they'll do paper surveys that can be filled out by social service agencies as they're meeting with their constituents. So being creative in how you can gather that information. Making sure you're using appropriate outside data. It is important to get some health data about your community, not just what people's perception is, because you want to have that good data to back it up. So whether that's your market data to understand, who is your population, what are those issues, the population health, and then other community factors that might impact health. And then accountability for action, really thinking about this not just as a once every 3 year thing that you have to do to meet the IRS requirements, but how can you put some accountability in place throughout your organization to ensure that things are happening? Again, collaborating with others in the community, and maybe there's ongoing regular meetings to assess what's happening, what each organization is doing, and how you're making an impact on that need that was identified. Making sure you're quantifying the results and communicating the results back to the public. And then just make sure you're prepared in case of IRS review, checking your website, making sure you've got things on there, making sure that answers on your Form 990 are consistent with what you've actually done. We do see that sometimes too, that there's things that are answered on the 990 that don't really correlate with the report itself. Making sure your staff is aware of these requirements, and especially those that are doing community outreach. So just as a wrap up here, I think committing to community health really has to be something that's applied throughout your hospital. Making sure that this isn't just a one-time thing, but you truly are making efforts to understand and address the needs of your community, getting that process in place for monitoring the impact, and quantifying the impact of your programs on your community. So with that, we will open it up for questions. I appreciate everyone's participation today, and hopefully you will join us for the next 2 sessions to build on these basics that we went through today.
Okay, so we did have one question come in. If your fiscal year end is June 30th, does that mean your CHNA is due by June 30th?
Yes, so your community health needs assessment is due June 30th. So your report has to be approved by your board by June 30th. Your implementation strategy, it needs to be done by November 15th. So that would be the due date of your tax return if you file a tax return, or it's that 15th day of the 5th month after year end.
All right, well, thank you everyone so much for attending, and thank you to Kim for presenting this, and we hope that everyone has a great day.